and welcome. It is 1 year of India's fight against the coronavirus. Today marks 1 year of India's fight against the novel coronavirus, which has affected over 1.07 crore people in the country. India recorded 13,000 new coronavirus cases today, 1 year after the first case. The first infection was reported in India, taking the total number of cases to 1.07 crore. India's first case was recorded last year today in Kerala, and currently India is number 2 worldwide when it comes to the number of total COVID cases recorded. The United States has the most number of cases. India is at the 4th position for death toll, with Mexico having recently crossed India's numbers. And India's vaccination drive was launched on the 16th of this month, and so far 33 lakh health workers have been vaccinated. So a year into the fight against the spread of the coronavirus pandemic, what do you need to know to arm yourself against COVID-19? What do you need to know to keep yourself and your loved ones safe? To answer your questions, we have joining us Dr. Randeep Guleria of the All India Institute of Medical Sciences. Dr. Guleria, thank you so much for your time. It is 1 year of India's fight against the coronavirus. Did you think we would be where we are today a year ago? Your reflections on the year gone by.
So I think the year gone by has had its ups and downs, and when I look back, we had a lot of challenges. Like you rightly said, we had a huge number of cases. There was a time when the predictions were even worse than this. But I would say what we also learned last year was that we are a very resilient country. Everyone got together, whether it was shortage of PPEs, whether there was a concern about ventilators. And we did manage, despite our huge numbers and our stretched healthcare system, because we didn't have a situation where people died because of lack of oxygen, or there was no ventilator available for people who needed the ventilator, unlike what was being reported in other countries.
Correct.
So there are success stories, but there were also challenges that we faced. And I think currently, when I look back, I feel a little bit of satisfaction that we are in a better position now than many countries in the world. I feel that the challenge forward is how do we sustain this good position that we managed to be in, considering that our cases are down, our recovery rate is good, our case fatality is low. And also, if as we move out and we become over the, say, next year or so, how do we really take the challenges and the gains and the lessons that we've learned from the last 1 year forward, so that we are in the future in a much better position than what we were last year.
I'm glad you brought that up, and I'm going to touch upon that given this is budget week. But first, let me ask you, in the past 1 week, India has not recorded a single coronavirus case in a fifth of its districts. This is what the government has said. This as our nationwide immunization program has covered over 25 lakh people. Now with 2 vaccines, we're saying we're at 35 lakh. How do you explain the number of cases falling so drastically suddenly? Because that's really on everybody's mind, because they're wondering, kya hua? Like, is there an explanation for why COVID cases in India have fallen so much? At one point, we were reporting 100,000 cases a day. Now, less, double digits in Delhi, 15,000 a day maybe.
I think there are multiple factors for that. One reason, of course, could be the fact, and we need to see the serosurveillance data, that in areas where there is a high chance of the virus spreading because of crowding, because of the fact that people stay close together, there good amount of immunity may have been achieved, and that's basically talking about metropolitan cities or larger towns. As we go to rural India, because people stay relatively at some distance and there's not that much of crowding as we see in cities, it's likely that there the transmission has been broken, and therefore the number of cases are less there. But I do still feel that maybe we will still have significant susceptible population. We need to see the surveillance data. The national-wide serosurveillance has been done, and by ICMR, and I'm waiting to see what the data is like. But I think that could be one factor. The other factors which you've been always saying is that we are a younger population, so we get milder disease, and many individuals may have got mild disease and recovered. And we may have some inherent immunity because of recurrent exposures, and our immune response may be better. But this is something which is seen not only in India, but in many countries in Southeast Asia, that they have done better than what the Western counterparts like Europe or US has done. But
Sure.
still, there is something that I like to say, that we need to be very cautious. We just need to look at Brazil. Brazil, they felt that they had come out of
I
the
was just going
pandemic.
to bring up the example
Yes.
of Brazil.
So Brazil felt that they had come out of the pandemic. They felt that they had achieved herd immunity, and came back to normal. And then they had a new variant which was more infectious, and possibly the immunity that individuals had because of infection more than 6 months ago waned, and that led to a huge surge in the number of cases. And now they're seeing a huge number of cases.
And a
So
new
although
variant in the virus.
variant in the virus, yes. So although our numbers are down right now, we need to be very, very vigilant, because things can change very rapidly, as we're seeing even in the UK and in South Africa. So good surveillance, good observation, and at the same time COVID appropriate behavior, and trying to vaccinate as many as we can as early as possible, I think should be the way forward.
And also other inexplicable questions of this whole past year. Kerala, doctor, logged the highest number of cases in the last 24 hours with about 6,268 infections. They're followed by Maharashtra, which has 2,771 cases. Kerala was where we saw India's first COVID-19 case being detected. It then became the poster child for pandemic management with its low mortality rate. But of late, over the past few weeks, we've seen Kerala logging the highest daily cases. It's the third most affected state in the country after Maharashtra and Karnataka, even though its health systems are, applauded all over the country and the globe. And they had been following all of these precautions strictly. How do you explain that? What do you think is going on there?
So I think I've not looked at it in great detail, but I think there are multiple factors. One, of course, is that it's a possibility that you are now being able to test more, and there is a spread of the infection occurring in areas where it was not there in the early part. Kerala did very well in the early part of the pandemic, and the number of cases were less. They were able to contain it, but they still had a susceptible population. And possibly now, when people's guard has come down and there's more travel, and you had a lot of the festive functions, there has been a resurgence of cases in those who were really did not have enough immunity, and this has probably led to increase in number of cases. But it's something that needs to be looked at. Kerala had done very well, and like you rightly said, they have a very good health system in terms of managing patients, but there also needs to be a good community involvement and community participation as far as COVID appropriate behavior is concerned.
But doctor, by that same logic, could it mean that other states aren't testing as such, and that's why we may not have the right numbers? Is that also possible?
So that was something that one looked at, and one was concerned. But if you start looking at data, because one other state that one really was thinking that you will have a huge number of cases was Bihar, but we didn't find a large number of cases there. But the testing there is still very robust. It's not that they're not testing enough, but for some paradoxical reason, the number of cases in Bihar, even after their election and after the Chhat Puja and all that, did not really rise as one had really anticipated. It was not related to less testing. They had continued to do aggressive testing because of this worry that they may have a resurgence of cases. So there are case studies in our own country which we need to really evaluate in great detail to understand the dynamics of what is happening at a ground level as far as the number of cases are concerned.
All right, Dr. Guleria, let's just shift gears a bit. This is a crucial week for India. It is a budget week. The economic survey was released on Friday. It addressed India's stringent lockdown. It said India's pandemic response focused on saving lives and livelihoods. It said that, the 40-day period was based on a humane principle that GDP growth will return, lives won't. Now, that said, the union budget is expected to fund COVID vaccinations and other interventions that will speed up the return to normalcy, whatever that is now. Could the budget provide a way to strategize for a reimagined Indian public health system? You've touched upon this at the start of the show. The pandemic has exposed how ill-equipped India's public health ecosystem has been to handle this health emergency at this scale? COVID-19 has added to the woes of our public health system. We were hobbled anyway by inadequate infrastructure and human resources. As a doctor, as an administrator, what do you expect from the budget? What would you like to see in the budget?
I think what we've seen in the last 1 year is that health is a very important sector when it comes to the overall development of any country. And what the pandemic really showed us was that if health gets affected, as it did in the pandemic, all other sectors also tend to get affected, because the pandemic really caused an economic loss, not only in one sector, but across the board, because of the fear that we did not have enough resources as far as the health sector was concerned. So in my mind, we have to have health at the center stage, and there has to be more and more investment in the public health sector. Bulk of the pandemic management was done in the public health sector, whether it be the preventive measures, whether it be being done at a primary health level through ASHA workers or the workers at that level, or at government hospitals, district hospitals. These hospitals need a lot of resources, they need a lot of investment. And if we are able to do that, not only will this be something that will be a boost for the economy, because very often people look at the health sector as a sector where there is investment only for in terms of service rather than as an investment for economic growth. There will be economic growth if we invest in this sector,
Correct.
But it will also support other sectors, because we need to have a healthy nation if we need to have a vibrant and economically forward moving nation. The second important thing that I would like to say is that it also showed that how important it is, especially in the health sector, for us to be self-reliant. We had a situation where a large number of our equipment, large number of things that are required in the health sector were being imported. We need to develop a strategy where good research and development is done here. There is a good environment for investment in health equipment, health manufacturing, and we must promote research in the health area, because that is something that could take the nation forward. One of the biggest good examples that we have is the research that has been done in vaccines.
Correct.
India is now in a very good position in terms of vaccines because of the fact that we are able to make our own vaccines and provide it for our own country. There is this whole problem that is happening in Europe because of the fact that vaccine production is becoming an issue there. So if we become more self-reliant, both in research, development, and we are already very good in the pharma industry, I think this will not only give a boost to the economy, but will lead to a very, very healthy nation. Therefore, the public sector needs to be really built in a big way.
It does. So this is a watershed moment, an opportunity to reimagine our public health system. Thank you, Dr. Guleria. I'm going to go in for a short break, but we'll of course play up this response of yours and hope that your words will reach the ears of our policymakers in the finance ministry. Let's go in for a short break. We'll come back and ask Dr. Guleria all those questions about the vaccine, when you should, whether you should, which vaccine, all of that. Back with Dr. Guleria in a few minutes. Welcome back. You're with the Director of the All India Institute of Medical Sciences, Dr. Randeep Guleria, to answer all your questions about the coronavirus. Dr. Guleria, India has currently 2 vaccines being used in our immunization drive. And this week, Germany's vaccine committee has recommended AstraZeneca's COVID-19 vaccine should only be given to people aged between 18 and 64. And that means not for anyone above the age of 64. Covishield is the equivalent of AstraZeneca, the Oxford AstraZeneca vaccine developed in the UK. So what is your response to why Germany has said so, and what does this mean for us in India?
So I think we need to see more data as far as this is concerned. The trial data that was put out by AstraZeneca did show that the vaccine was immunogenic and gave good immunity to the older age group also, and they have said so in their subsequent press release. The study the data which Germany has collated in terms of, I suppose, antibody formation is less. There has always been a concern that as one ages and there is what we call immunosense, your immune system may not be that responsive in terms of producing antibodies. But the current data from all of the vaccines, I would say most of the vaccines which have looked at even the older age group, if it's in a small number, have shown that it does have a good immune response. Now, having said that, it's always important to remember that you may have variation when you start doing it in a larger number of people, because every individual and every ethnic group behaves differently. Also, you may have individuals who may have underlying other comorbidities, which may also lead to the immune response being hampered or being less, and therefore it may not be that immunogenic. So we will need to have more data before we say whether we need to give a higher dose or a booster dose for the elderly based on the immune response that they have. Currently, I think there's insufficient data to say that this vaccine is not effective in the older age group.
All right. The other big story today is that the Serum Institute says that they will be applying for permission for trials for a new vaccine, the Novavax vaccine, which they say they will launch in June. How does this change up the game?
So I think we need as many vaccines as we can get, because of the simple reason that numbers that we have to vaccinate is huge. Therefore, we will need to get more and more vaccines. The challenge that I see is that now for any new vaccine, doing a vaccine trial is going to be very, very challenging. Because when we did not have a vaccine, you could do a phase 3 study where you had one arm which gave the vaccine and the other arm which was the placebo arm where you did not give the vaccine. Now, when you have vaccines which have got emergency use authorization and you're having a pandemic, it may be unethical to have a placebo arm and not give any vaccination. So it would be worthwhile really to have what we call a non-inferiority trial, that you give the current available vaccine to one arm and compare it with the new vaccine that you're going to develop in the other arm. Or we need to develop what we call surrogates of the efficacy of the vaccine, that we look at how titers of the neutralizing antibodies or the cell-mediated immunity, based on that, infer that this vaccine is going to be effective without doing a traditional phase 3 study. So it's going to be challenging, and I see a lot of vaccines coming out in the next 6 to 8 months. The Dr. Reddy's laboratory vaccine, the Sputnik 5, should also be available, and the Zydus vaccine should also be there.
All right, fascinating. We'd love to get more in depth with that, but we're out of time. So I just want to ask you one last question. You've said so clearly at the start, this is not the time to get complacent. We have to continue to keep ourselves safe and protect ourselves. But overall, it seems India has moved on, Doctor. Governments have allowed pools to reopen. The Odisha government today announced 500 people allowed at weddings. Schools have reopened. Does this sit comfortably with you? And last, many parents, including myself, were grappling with whether to send kids to school or not. What would you say to audiences listening to you right now about 2021?
I would say it's still a little early to really start opening up so quickly. We haven't really got over it. We are in a good position, but we must maintain this good position for a few more weeks so that we have sufficient number of individuals vaccinated, and we are able to say comfortably that the variant strains which are being now seen in different parts of the world is not going to affect us in a big manner. Otherwise, if we really open up and we have a situation as has happened in Brazil, we will suddenly have a huge spike in the number of cases. So we are in a good position, but we must continue to work to maintain that. And if that means having COVID appropriate behavior for a few more weeks, I think that's a safer option than having to regret later on.
Dr. Guleria, thank you for speaking to us on NDTV. Thank you again. Bye.
Thank you.